So we've had a number of engagements between ourselves as Stanbic Bank and St. Mary's Hospital, and I'll say the Assumption Sisters in general. And I think the last discussions we've had, most of the discussions around our partnership has been around banking services to St. Mary's Hospital and banking services to the members of staff. But then as time has gone by, in the current scenario we're operating in, people calling it the new normal of COVID-19, we've seen some effects to society and some setbacks in how people operate. So, and then if you look at the kind of numbers that the Ministry of Health has been giving us it used to be a 4 p.m. bulletin every day telling us how the regions have gone around and all that. It gives some fears in some of us, and it gives hope to some other people. And with you people being on the now commonly called the front line, we then ask ourselves as a bank, how are we going to work with the communities that we support and see what impacts we make? So we made a partnership with the Rotary Club, and as we do the partnership with Rotary Club, there's a Rotary Club within the bank, and then there's which is part of the bigger Rotary Club. So we say there's some things we can do as a bank, but there's some things we can work with people who have done them better. So Rotary Club has been able to do some of these activities stronger. So the first groups that we took care of were general market areas and children's homes and that kind of thing. So we reached out and we've supplied similar equipment to some of them. So when there was a need that was expressed to us around the privacy of patients, which Sister, I always forget, Sister Dr. Karen, I don't know which one comes first, had been having engagements with our colleague Felix around addressing that. So he said, okay, yes, we can deal one piece, but we also appreciate that there's a challenge. And the challenge is, we've been told one of the safety measures of addressing COVID-19 is washing hands. And one of the other challenges has then been, do we have sufficient hand washing stations around? So we then thought as a bank we should be able to provide some, alongside our gift towards patients' privacy, we also provide some hand washing station. So as part of our social economic support from the foundation, we'll be today presenting 10 hand washing stations, which we believe will go a long way towards supporting the hospital community towards managing the COVID-19 scenario. So today we'll be presenting on behalf of Stanbic Foundation the 20 hand washing stations. The check we are presenting today is towards meeting the cost of the curtains for the wards.
We want to sincerely thank the Stanbic team for their thoughtfulness and for having been true friends. You know, a friend in need is a friend. Indeed, when the corona came, as it struck all other parts of the society, as St. Mary's, we have equally felt the effects of the corona. And it is at this time that you stretch your hand and you are lifting us to be able to continue offering quality services to the clients and to the patients that come to our hospital. So we want to really thank you most sincerely. You know, we also bank with you as a facility, and you have been so understanding, especially at this time when we need help in matters bank and now in matters patients' care. So one of our agendas that we have at this time is to provide privacy for our patients, along with the other plans that we have put in place, procuring the equipments and ensuring that the services are there. So privacy has been our key intention. And when we reached out to you and you responded, we are really so grateful, and we want to ask God to bless you abundantly, that God will continue blessing our partnership, our working together, St. Mary's Mission Hospital, and the Stanbic Bank, that we may continue partnering even in other more things to come, to be able to improve the lives of the people we are serving.